but it's been a really enjoyable one, and I have to say that I've really enjoyed all of the previous talks, and I think they've really set the stage for helping us understand what are the associations, and in some instances with the more causal data, what are these links to the health outcomes. And so what we are doing in my shop is that we're trying to take a look at, if you think about what are some potential policies that you might be able to affect behavior with, so that we can actually get individuals to change their behavior. And so in the, you can say in the hospital or in the physician's office, you might be thinking about more one-on-one education. Here we're really stepping back and thinking, what can we do at a really broad level? I think this goes to one of the comments that was made earlier, that some types of policies that may be more individually tailored might have a very large effect. Other policies that are delivered more broadly might have smaller effects. And so this is something that really falls into that latter category that is quite broad. But what we're going to try to show is that in some instances, depending on the size of the policy, it actually could even have a large effect. So I'm going to talk to you a little bit about pricing. So being an economist, we've talked about biases here and maybe biases from the industry. Well, maybe I should sort of divulge. A bias from economists is that we really do believe that individuals respond to prices. Okay? And so you may think that you might be addicted to your Coke, but at some point you are going to start to change your behavior as the price gets higher. So I'm going to talk to you a little bit about trends. I'm going to talk to you about the relationship between pricing and outcomes. And then I'm going to tell you what we're currently doing in the country in different states in terms of taxes, because there are taxes on soda in the country, and about some initiatives. Okay, so you heard a lot about the sort of amounts that kids and adults and younger kids and adolescents are consuming, but this just sort of puts into perspective. You can really see that the adolescents are the largest consumers of SSBs, and pretty much, except for the 20 to 64-year-old have the coffee and teas, but they're fairly large consumers across the board, and the 6 to 11-year-olds are slightly larger on the juice side. One thing, though, that is good, and not to say that this issue is being resolved, but these trends among children have been dropping. So although adolescents actually are the largest consumers, they've actually seen among the different age groups across children, they've seen the largest decline over time. It'll be interesting once the 24-hour recall data from NHANES are released for 09-010, because it's also hard to know to what extent this 07-08 data is potentially reflective of economic downturn and whether this is going to lift back up. So as an economist, I'm a little leery. We've seen this with some fast food consumption as well, that there's been some downturn, so we need to follow those trends. But one thing I want to point out is let's talk about the trends in pricing. So in real dollars, accounting for inflation, costs of fruits and vegetables have been going up over time. The cost of carbonated beverages have been falling. So it's increasingly cheaper to put carbonated beverages on the table at dinner or to go out and buy them as a youth over time. At the same time, restaurant consumption has been relatively flat. So in real terms, you can think about the fact that when healthier consumption has been going up, it's been cheaper to eat at restaurants, both quick service and full service, and youth obtain a substantial amount of SSBs, particularly soda, in fast food restaurants. In a recent study we just finished, we found that if on a day a youth consumes in a fast food restaurant, if they eat in the restaurant vis-a-vis takeout, they actually consume twice as many additional SSB and soda calories. And as an economist, the first answer would be why? Because of the free refills, right? So if you're consuming it in the restaurant, even vis-a-vis the same fast food out of the restaurant, it's twice as many additional calories and grams of soda. So just a bit of background, given that I don't think there are many economists in the room. So what are we economists? What's our kind of view on how do we think? So the economic framework then is thinking, okay, well, individuals are out there to maximize utility, which just is another word for happiness, right? We all are, and we're constrained. We face prices, we make a certain wage. So we've got this budget constraint. On the one hand, we've got a certain amount of money coming in, and we can only have a certain amount of money going out, and we're time constrained as well. Okay, so what is the primary idea here? Well, the policy instrument is that we really are trying to think that we want to change the relative costs and benefits, which in turn is going to change behavior. So what the idea of SSBs is essentially to make those items relatively more expensive than other potential types of drinks. So the last example that you just heard of, exactly that. Make the sugar-sweetened beverages more expensive. That change, you don't even have to change the healthier product, because that's already, you just have to change one to change relative price. If you change both, if you make the unhealthy one more expensive and the one that's healthier for you less expensive, then you've even widened that gap further. So we just saw the example, you went from that $1.95 once the price was bumped up to $1. You're talking about, right, almost double in terms of relative pricing. So you can imagine it might be not just your preference, but you're now thinking, well, Jesus, actually I do enjoy water. So if we do want to think about health benefits, tax burden, and subsidies, a lot of individuals, as soon as you start talking pricing mechanisms, think these taxes, are regressive. All sales taxes, all consumption taxes, yes, they are regressive because lower income individuals spend more of their income, as opposed to higher individuals have the fortunate ability to be able to save more. But you can also think about a tax brings money in. That tax revenue could be redirected back out in the form of subsidies that could be targeted, potentially, say, to fruits and vegetables. But if lower income individuals are actually more price sensitive, and you tend to be more price sensitive when you're spending more of your income and money share on items, then you would actually derive more of the health benefit. So if you're more price sensitive, you're going to change your behavior more, and in turn derive more of the health benefit. Okay, so there are a number of studies that have looked at, so there's a large literature in economics that looks at demand for food, let's say in general. So soft drink consumption has been found to have a price elasticity, and I'll explain that in a minute, of about 8%. And what that means is that if taxes or the price were to go up by 10%, consumption would go down by, well, 7.8, let's round off to 8%, okay? Some more recent studies have found that the effect is actually potentially even higher, suggesting that a 10% increase in price would lead to a 12.6 reduction in consumption. Some of the taxes, as you're going to see, that have been proposed have been roughly about a penny per ounce. When you translate that into percentage terms, because of course different prices depending if you buy a case of cans, it's much cheaper than just walking into a convenience store and say spending $1 for a 20 ounce. But on average, a penny per ounce works out to about a 22% tax. So we're not talking about a small tax. So if you imagine almost a one-to-one relationship, you could think about a 20% increase in price resulting in a 20% reduction. Okay, so we have linked data on taxes to a number of different data sets. Some of them are cross-sectional, some of them are longitudinal. So, obviously you have the potential concerns about compounding factors at the state level, and these are state-level taxes. So what we did was we looked at the tax rate that's in place in the state, and that's typically the sales tax rate. So food is often exempted, but so there's certain items that are not. So if you go into the grocery store and you're putting all your items in the cart and you get out through checkout, you might notice at the very bottom, or sometimes there's a T next to your item, those are taxable items. And soda in most states, and 35% of them in 35 states are taxed. So we linked this. First we linked it to some home scan data, which is data where individuals scan every single purchase that they have in the household, and we control for all of the socio-demographics of the household, the size, composition of whether there's kids there or not, race, educational attainment, employment status, where they were. And we found fairly small tax elasticities. But remember, if we were thinking of going on average right now, the tax rates are about 3 to 4%. They range from 0 to 7. So if you think about doubling the tax rates, we found that if you did this, household purchases of regular soda would be, if we put everyone at the maximum at 7%, which would be about a 60% increase, essentially you would have a 3.6% lower consumption. However, if you think about the extent of moving up to roughly a 20% tax, which is where the proposals are coming out right now, then you would actually estimate that consumption would go down just over 25% at about 27%. So we're talking about a fairly substantial reduction. Now this study only looked at soda. So then you've got to, of course, economists and others who are looking at this are considering, well, what about substitution? Because there's also potential substitution to the untaxed sugar-sweetened beverage, right? So if you only were to tax soda, maybe you're going to start substituting towards Gatorade or a sweetened tea or something else. So this is going to come in later about you really need to be comprehensive so that you tax potential substitutes. Otherwise, you may not yield an overall effect. You might get a reduction in soda, but you may not yield a net reduction in SSBs. So we're just going to talk a little bit also about how we linked these data to some weight outcomes. And we did this with the early childhood longitudinal education study, and I'm going to jump to the results. And basically what we did was we said, if we imposed an 18% soda tax, and at the time when we did this study, the state of New York had proposed an 18% soda tax. As you can imagine, with the extent of lobbying that went on, it didn't go anywhere. But it was really the first place to kind of step out and say, okay, we're going to propose a large tax. So in our model, what it showed was that if there was an 18% tax, if we basically looked at our results and estimated out, that would have been a reduction of about 0.23 BMI units, which reflected 20% of the excess gain in BMI. And interestingly, this number is exactly the number that I saw earlier today when talking about that change in BMI, and SSBs were 20%. Our model actually is predicting that this a tax of this size would lead to that reduction. So another study that we've actually just done is to look at some longitudinal data, so that we are looking at the same individuals over time. So that we can account for some unobserved preferences that they might have, or make sure that it's not something else going on in the state other than just the tax rate. So we linked these tax data for 4 years to the same adolescents over time for 4 ways, and we were able to control for a host of variables, including what the individual's income was, what their parents' income was reported by the parents, which is always important in these kind of studies, because if you have adolescents, you may know that they don't always necessarily know what your income is. And their education, and a whole host, even the neighborhood income that there was. And in this instance, we found elasticities of approximately negative 0.22. And what I'm going to show you here is that these were fairly moderate estimates, but if you double the tax rate from what it was on average from about 3% to 6%, BMI was estimated to go down by about 3%. So if you can imagine expanding this at a population level, you can think about fairly large effects for the population as a whole. This is, soda taxes are by no means something that are intended to say, well, we don't want people to drink soda. It's estimated that, but if you can bring down everyone's consumption by a certain amount, and hopefully those who are heavier consumers who spend more of their relative money, you would expect them to be more price elastic, so you'd actually get an even larger change among that group, and those are the exact people that you want to impact upon. So let me just let you know what some of the tax rates are and give you some background in case you don't know what some of the policy is right now. So we do tax a whole host of different drinks at the moment. So soda, the rate on average among those states that tax is about 5%, and it's 35 states currently, and the highest rate is 7%. So the tax rate right now is there, but it's fairly small. Okay, just to give you a sense of where it is going on in terms of the map as a whole, and it's interesting. You can see it's interesting to sort of map some of these against the CDC's obesity maps that they have. But here's what's been going on recently. This is just a sort of a small collection. The Red Center at Yale has a very nice website where you can go in if you're interested in any of the policies and pull these up. We've been pretty close in some places. I've only put some states on, but 2 cities. DC and Philadelphia. In Philadelphia, they actually came close, and they only lost by 1 vote twice. So this is going to happen. So I like that quote earlier, change will happen, and there may be some pain, but this is something, this policy is going to happen, and one of the reasons is because it brings in money, so you can have a public health effect, and you can bring in some income, and then you can turn around and spend that income and dedicate it in order to improve health in terms of health prevention. And you can notice on this, and what is that almost all of these in the brackets you'll see, special, well, let's look at Illinois, revenue to create Illinois Health Promotion Fund. Every single place now, and polling has showed that if individuals are more accepting of the tax, if there is a dedication for prevention and the funds will be dedicated for obesity, and even higher if it's for pediatric obesity. So if I was a state, I would recommend explicitly put in there for pediatric obesity. So just a couple of things before I finalize. What are some of the issues in terms of if you're thinking of designing a tax? Well, first of all, the way we do this right now is that we have a sales tax. A sales tax you actually don't pay until you get to the register. So at point of sale, when you're making that decision in a grocery store at the shelf, you don't see the price of the tax in there. Now, if a child is going to the convenience store, they might know, okay, I'm going to have to come up with that 7% extra for the one item I'm buying. But when you're buying many items, you're not going to see it. So you need an excise tax so that you can see it right on the shelf, because the whole point is to actually affect behavior. So you want in the shelf price. The other thing about an excise tax is it's applicable regardless of where the item is sold. And you don't want the tax to be a function of the price. You want it to be a function of the unit sold. So if it's a penny per ounce, and you go to that 64 ounces that was shown earlier, you're going to have 64 cents worth of tax. Otherwise, you could have quantity discounting. Often you see that when you go into McDonald's, one size is $1, the next size is $1.05 and $1.10, but it's almost twice the size. So any rational consumer would buy the largest size because you're getting more volume for your money. So the excise tax gets around this quantity discounting. And importantly, the free refill. Okay, so restaurants will have to figure out how they're going to deal with that. Another issue is applicability to SNAP participants, the first point there. Right now, individuals purchasing with SNAP do not pay taxes. So if you were living in a state with a 7% soda tax, ideally, if you were the rational consumer, you would put your soda on the conveyor belt first, along with any other taxable items, and pay for that with your SNAP, or in Illinois, your Link card. And then after that, if your Link money didn't cover all your purchases, you would put the rest of the items through so that you could avoid the tax. But if the point of the tax is to try to affect behavior, then we need to think about changing that policy and not have these items being excluded from taxation. And then I can come back to this final point about tax revenue and dedicating these funds in order to put the money back into state programs, community level programs, and also have some of those directed to low-income individuals, potentially in the form of fruit and vegetable subsidies. For Illinois, let's go just right down to Illinois. We could raise $600 million with a 1 cent per ounce tax. My time is up, so I'm just going to say this is one solution, but there are many other public policies. And I'm not going to talk about these, but I just want to say that these could be complemented. So we heard today worksite restrictions on availability. We just heard all about that. Items that are sold in schools. Zoning policies around fast food restaurants, because fast food and SSBs are really tied together when you look at the consumption data. Menu labeling that's been talked about. Advertising restrictions that have been mentioned. And public service announcements to then counteract the constant bombardment that children and adults get every day, try to counteract some of those. So to tie this back to your patient, you might want to tell them that the cost of consuming SSBs is going to go up. So if you want to get ahead of the curve and save your wallet some money, start the reduction now. Don't buy it for your kids, because you're not going to want to buy it for your kids when it costs 20 or 30% more. So not only will you save your health, but you'll save your pocketbook a little bit of money, and you can turn around and spend that on some healthier items in your household.